What's going on, y'all? Terrell Friday with FutureDDS.
Tyler Brown here with FutureDDS.
And today, we're going to take you through our Cdca licensure exam experience. Let's go.
So, if this is your first time visiting our channel, what Terrell and I do is we basically give tips and tricks on how to get into dental school, as well as show you all our dental school experience. So if this sounds interesting to you all, please hit the subscribe button and the notification bell so that you know whenever we post new content.
So, the Cdca exam. This is the license exam that Tyler and I took, but it's one of a few license exams out there, others being the REB and the credits exam. The license exams are about $2,500 and they're typically broken into a few portions. The Cdca is broken into 3 portions, and we took the first portion recently, a couple weeks ago now. Time is flying, but a couple weeks ago now, and that was the pros and endo portion. Next, we have the written portion, which we're taking sometime in the fall. We have different dates depending on when you signed up or where you're taking it. And then in the spring, we'll have the operative and perio portions. So, again, this is a $2,500 exam, and it's a 7-hour exam. So let's just say it can be stressful and very taxing on you, especially preparing for it, So we're gonna take you through a little bit of our experience and how we decided to go about preparing for it, some things that we heard, some tips and tricks that we can give to you guys to help you guys through your process when you guys decide to take your license exam as well. Let's get into it.
All right, so we're gonna talk about the pre-test, during the actual test, and the post-test.
Right.
So pre-test, as you all know, we're going through quarantine right now, so I don't want to say our hands aren't where they need to be, but we definitely haven't had as much practice as we would have liked.
Right.
Luckily though, because of the Cdca coming up, our school opened up our labs so that we were able to have a couple of practice sessions to make sure that we were at least competent in the things that we were about to be doing. And so I think at least specifically for the last 2 weeks before the actual test, we were in there pretty much every day for about 5 or 6 hours, just going through the procedures. And somebody might say wow, that's a lot of time. Y'all are in there for a total of 50, 60 hours. But you also have to remember that the tests we're doing, we're being tested on 5 different teeth. So it's a lot, and us doing one sitting of the entire test is about 7 hours. So imagine if we were to emulate that or simulate that in the preclinical situation, that's only 1 day. That's 1 day of us practicing. So granted, it sounds like a lot of time, but it really wasn't that much time for us to get ready.
Like Tyler said, we don't have too much time to actually get in there and practice. So that means we had to be extremely efficient when we did go in there. When we had our initial practice sessions, they gave us a set of practice teeth that we had to go in there. So you had to really ration out what you had to do. And of course, they were more available to you if you needed them. But you wanted to make sure you made it every rep count. And that was a big thing for myself, and I'm sure Tyler and other people going in there as well to practice. You get in there and you just try different techniques. You review the PDFs for the prep, the manuals, and you look at the manual for the Cdca to see what their regulations are, what their requirements are for passing it. You make your own cheat sheets based off of the lectures that you've seen in school or things you might have seen online or YouTube, different techniques that you've picked up in clinic even, and then you go into it with the game plan. So you go in there with endo, you make sure you have your guidelines on what the access needs to look like, what the canal should look like, how the process, the step-by-step processes, and you make it muscle memory so that when you get in there the day of, it's kind of like another day, just another day in the lab. And that's kind of what was my mindset going in there with the mission, so that when you get it done, it kind of seems like an accomplishment and you can emulate that on the day of your actual exam. So
then the actual test day, it was interesting. We actually had to, because our class is so big, we had to split our Cdca day up amongst 4 different days. Yeah. So I was the first one, Terrell went the day after me. But I want you all to remember, like I said earlier in the video, we haven't been in clinic, so that was the number one thing that was a little rough, actually being, of course my ergonomics were correct, but literally being over the typodont for 7 hours. that was one of the biggest obstacles during the actual test.
Fatigue, man.
It was a lot.
Man.
It was a lot. And I mean, granted, we laughed and we joked about like, oh, this is how the rest of our life is going to be. And that's obviously not true. I mean, we were literally focused on one tooth or I guess 3 teeth for hours, and then 3 teeth. Three teeth for hours, and then of course 2 teeth for a couple other hours. So, whereas in real practice, we'll see a tooth for 15 minutes, 20 minutes, come up, stretch a little bit, and then go to the next one. But no, it wasn't a nervous type of situation. I think that because we had practiced the exact tooth and we're doing the exact procedure in pre-clin, I went in confidently, but I think that another thing that, was going through the back of my head throughout the entire test was, for instance, when we had to do the endo portion, when I was practicing, I would literally do the endo, do the whole procedure, and then take the tooth out and make sure I didn't go through the apex of the tooth or anything of that nature. So keep in mind, that's the first thing you do in the entire CDCA day. So I did that, but in this situation, I couldn't check the tooth. Yeah. So I'm sitting there while I'm working on my number 14, I'm working on the access for that one. Yeah. I'm wondering, I'm like, I hope I didn't go through the apex, or I hope I filled up the canal enough. So little things of like that kind of took a little bit of a hit to my confidence. But I mean, overall, it was a pretty decent test. Yeah, I don't know what you thought.
Definitely, it's an element of uncertainty as you're going through it, because usually, like you said, you can get somebody to come over. Hey, Tyler, come check out this prep. Come check out this 9. Come check out this 3. You can check the path of insertion, just take out the typodont, while you're working on it. Versus you get there and it's literally like by the book. There's no do-overs, there's no mulligans. So every pass of the bird counts, so to speak, and you gotta really be so locked in. I think that was the biggest thing, so you had to really take a step back, and that's what I did. Take a step back, really take a deep breath, do take a little extra time to stretch and take a little extra time in between time. If you finished early, you were able to take some time in between endo and pros. So luckily was able to do that, walk around, get outside, kind of get some fresh air.
And when we say a break, how long do you?
Oh, that was maybe like 15 minutes, like 15, 20 minutes after being locked in for 2.5 hours. So, it's definitely taxing. On top of that, having to come right back and do pros for another 4 hours. It's just a lot. It's a lot. But, if I had to go back or if I had to tell, somebody coming after me some tips or my biggest things going into it, I'd say don't be too hypercritical of yourself. Know your guidelines. You've been practicing your guidelines. Stick to that, and don't be too hypercritical in there, because you'll literally take 10 minutes doing barely making any adjustment to a tooth where you could have easily been, done a occlusal reduction or, done another, axial reduction or something like that, where you're sitting there really trying to get like a 0.1 millimeter on one side, so.
Definitely. I think my tip would be more so for the day beforehand. I don't know about you all, but I know that the day before a test, it's really hard for me to sleep, really hard. Yeah. And for the CDCA, you have to wake up fairly early. I think we had to be there around 6:30.
Yeah, you get there early at 6:30. You had to be there pretty much about 7:30, at the latest.
You see, so it's like if you have one of those days where the day before you wake up, you drink coffee. No. If I was you all, and granted, this is kind of like off off the tracks a little bit, I would wake up super early the morning before. So I'm saying 3:30, 4 in the morning, the morning before. Go throughout your entire day. Don't drink coffee. Don't do anything, so that by the time it's around 8 or 9 or 10, you're ready to pass out and you can get a good night's sleep. I think that if you don't get that sleep, your anxiety mixed with your tiredness, that can really create a bubble of disaster. You know what I mean? So you definitely don't want to do that. Make sure you get your rest and just stay confident. Stay confident. So now that we've both taken the tests, it is what it is. There's literally nothing that we can do. I think we're supposed to get our results within 3 to 4 weeks.
3 to 4 weeks, yeah.
But yeah, the worst case scenario, everybody, is that we fail. Hopefully that does not happen.
That's not going to happen.
But if it
No,
did
please don't
happen, I think that we would have another opportunity to take it again in December.
Yeah, December.
We'd have to pay, I think, $1,000 per section. I'm not sure.
I think it's per section. So if you fail, the pro section is 1,000, and that's one of any of the 3 teeth. And then the end of session is one of either of the teeth, and it's 1,000 per session. So.
Right. And I mean, hey, you know what? If that happens, it's not the end of the world. We both feel pretty confident.
Yeah, definitely.
Because it wasn't, I think that's another thing that kind of helped us. It wasn't a test that we felt was unfair, you know, and I think we are confident in the fact that if we do have to go do it again, you know, with a couple of more practice sessions and, you know, just a couple more reps, we'll be able to be successful within the test. So,
It's nothing we haven't done before, you know. If just go in there, again, like, you know what you're doing, stay confident. If it's 2 millimeters, do 2.5 first and then clean it up, you know. Just give yourself a little leeway. You'll be fine. So just be confident.
Oh, and also everybody, granted, next year when you're taking it, or if you're watching this video and you're about to take it, go to your your e-board or whatever it is, and make sure that they have extra practice teeth.
Yes.
Make sure, especially if you have a bigger class size, that's critical. Because if you don't have teeth to practice with,
you just gotta order more. Like,
it gets tricky.
Make sure they're there, you know.
Shipping times are kind of rough during this COVID situation. So remember that. Talk to your e-board. Make sure that they have numerous teeth available for you all to practice with. But yeah, I mean that's pretty much it.
Thank you guys for tuning in. If you guys haven't already, make sure you hit that like button, the subscribe button, and the notification bell. If you have any questions for Tyler and myself, you can head over to Instagram and follow us at _FutureDDS. Shoot us a DM. We'll get back to you as soon as we can. Or if not, you can add it down to the comments. You know, maybe somebody else might have an answer for you or can help someone else. So that's going to be it. Thank you guys for tuning in. We'll see you guys next time.
See y'all next time.